Hello, Dr. Vikki Petersen here. I wanted to speak with you today about your body shape. And we think of fruit when we think of body shapes. We have the apple shape, which is more wider at the waist. And then we have the pear shape that's narrower on the top and wider in the hip area. And the pear shape is the shape you want to go for versus the apple. The apple shape, where you have a larger midsection or larger around your waist than you are around your hips, is indicative of more fat going into your organs, which is dangerous, and it basically contributes to something called metabolic syndrome, which is a syndrome that we now know is associated with really the major killers that we're trying to avoid in this country: heart disease, diabetes, cancer, most diseases actually, because this fat that's in that midsection and infiltrates into the organs is bad fat. It's pro-inflammatory fat. It's a very irritating fat, and we know now that inflammation is really the beginning of most diseases we're trying to avoid. What's exciting about this is that we also understand that most degenerative diseases are lifestyle driven, meaning what we do to this body on a daily basis. And one of the biggest facets is what we put in our mouths. So this is going to be a two-part video. This is part one, and basically I just wanted to introduce the concept of apple versus pear and teach you how at home you can figure out what shape you are. So I'm going to stand up for this next bit. You'll hear me, but I don't think you're going to see my face anymore. So the first thing you want to do is determine your waist measurement. So you have the top of your hip, and then you have the bottom of your ribs. For me, there's about this much distance there, not very much, so maybe an inch or two distance. So what you want to do is you want to get a soft tape measure and go right around your waist, which is, as I said, just above the top of your hip and just below the bottom rib. So that's measurement number one. And then measurement number two is your hip measurement. And if you go down your legs, you'll feel a bony prominence, and that is the place to get your hip measurement. So measure your hips there, your waist up here, and that's how you're going to start. So then, and if you don't have a soft tape measure, just get a piece of string and then figure out what that is on a hard ruler. You know, it doesn't have to be, you don't have to go out and invest in a soft tape measure. So when you have the waist measurement and the hip measurement, you get the ratio by dividing the waist by the hip. So for me, I think I'm 27 at the waist and 36 at the hip or something like that. And when I divided the 27 by 36, it came out to 0.75. So I'm a pear, which is good. What women want to be is not greater than 0.8. So when you divide the waist by the hip, just get a calculator. You don't want to be greater than 0.8. You want to be under that. For men, they don't want to be greater than 1.0. So you'll know women are a little curvier, and so men can be more straight up and down. So as long as they're straight up and down, meaning that waist and hip are about the same, then that's okay for a man. But as soon as that waist is bigger than the hip, then they're into the apple shape, which is the dangerous shape. And measure your children as well. We now know that metabolic syndrome can start in children as early as 8 to 10 years old in this country, which is ridiculous because it used to be something that we didn't see until people were in their 50s. So our diet has not been kind to us as far as that is concerned, but it's something we can do something about. And it's very exciting to know how preventable these diseases are. But getting back to these measurements, that's the number one number I want you to get, and then write me back and tell me what you're finding. And then we're going to go into, in our next video, other numbers you should get as far as if you've recently had a physical exam or your annual physical. Some of the numbers you should look at, some of the numbers that are kind of worthless, and believe it or not, total cholesterol is a worthless number. I know that should pique your interest. I'll explain it next time. But there are numbers that we now know are more illustrative of really problems with heart disease and metabolic syndrome, and they're not the typical numbers that we've been led to believe. So it's not my opinion, of course, research-based, and next time we'll talk about other numbers you should find if you can, and then dietary changes to make so you really can start reversing any tendencies away from heart disease, away from diabetes, away from cancer, away from most degenerative diseases. Isn't that great that there's actually something you can do lifestyle-wise that will make a difference in your tendency and your motion toward all these degenerative diseases? And that's pretty exciting. So until next time, I wish you very good health. Get back to me, let me know what your numbers look like. And don't forget to check your children. And until next time, I wish you very good health.